For TeCK Alliance, I'm Arms Bumanlag. Accessing information about patients transferred from one hospital in the Windsor-Essex region was problematic in the past. Enter a groundbreaking information system. Evolve went live in southwestern Ontario at Erie Shores Healthcare, Windsor Regional Hospital, Hotel Dieu Grace Healthcare, and Chatham-Kent Health Alliance, all during the COVID-19 pandemic. The four healthcare organizations joined forces through an initiative of Transform Shared Service Organization to manage the transition, relying on the Millennium HIS Canadian build pioneered at Kitchener-Waterloo's Grand River Hospital. I sat down with Lyn Baluyot about how this put YQG on the map in terms of medical tech and adoption in the province.
So starting just right before COVID hit in 2018, 2019, the hospitals in the Windsor-Essex area launched on an initiative to implement an electronic medical record, which is pretty amazing, which is essentially taking everything we do in paper in healthcare and putting it into a computerized system. And why is that important? It means now that amongst the four hospitals that are live on the system today, soon to be all five in Erie St. Clair, that the health record is completely connected for the patient. So think about it from a patient's perspective. If you are receiving, for instance, cancer care at Windsor Regional Hospital, but say you went out to visit your family out in Leamington and you weren't feeling so hot and you decided, you know what, I probably should check into the emergency department at Erie Shores Healthcare, the physician at the emergency department can easily pull up your record and know, hey, Lyn's on treatment at the cancer center. Maybe that's what's causing her illness. Lyn now doesn't have to repeat her entire story. It's there. I know as the emergency room physician, I can reach out to her cancer doc and figure out what can we do for Lyn while she's at my hospital. It alleviates so much burden for the patient, but as well for the providers at the end of the day.
It's pretty incredible to think too. I mean, because again, prior to COVID, people would be not bouncing around, but you go to different areas, different specialists for different things. And then you're right, from that patient perspective, you're sort of regurgitating, for lack of a better word, your story over and over again, but you have this centralized system that allows healthcare professionals, doctors, nurses, specialists to tap into that information and use that cutting edge technology. So getting that kind of infrastructure into the hospitals and the healthcare providers too, that was, for lack of a better term, no shortage of a small miracle, right? Because a lot of these, you're teaching people, you're addressing different infrastructure systems to say, how do we bring this up to speed?
Absolutely. And it's, everybody says, well, it's just putting it on a computerized system. But you have to think about it. It's about, how many computers do we need? Where do they need to be? Do I have the right internet capacity? Do I have the right cabling and all that, all the technical stuff? But now you have to also layer on that everything related to cybersecurity and making sure people are properly trained on cybersecurity so that once the information is in the system, that it's also protected. So it's a lot of moving parts all at once that had to happen. I can't say enough for the Transform team, our Cerner partners, but more importantly, our hospital partners who saw this through an incredibly difficult time. We went live literally 5 months after, at our first site at Erie Shores, 5 months after COVID was declared a pandemic. People thought we were crazy to do it, but we did it anyway. The leaders at each hospital said, we've waited too long. We can't not have this system. And we pushed through. Working with partners today across the province, this is an important foundation for us as there's a lot of work happening provincially to try to connect to other hospitals and their medical records as well.
So, I mean, having this set up and having the success that you've seen here locally, and getting sort of breaking down those technology silos, so to speak, right? Getting that information flowing and the new technology into the hands of the healthcare providers too. From a provincial perspective, so are they tapping onto you and Transform and the folks who made this happen to say, okay, what are the best practices here? How can we kind of extrapolate this for this information exchange that's going to benefit the patient?
Absolutely. So we've been fortunate enough to be now seen as leaders in what we've been able to accomplish amongst our four hospitals. And we've been asked to sit on several committees at a provincial level to discuss how do we connect to the other systems like the Meditechs of the world or the Epics of the world to lead the way on that, as well as how to support going beyond the four walls of the hospital. That's the next frontier, if I want to call it that. So that how do we connect our community providers into the hospital so that they have access to the same medical record that is happening at the hospital as well?
So how much of this, and I know you said this was a huge undertaking, like 5 months into COVID, you go live in Leamington and then eventually rolling it out right across Windsor and Essex counties shortly after. Um, Honestly, I would obviously say, success, but this has been something that, it's not only just putting the devices and the programs and the infrastructure in place, but it's also educating folks to really adopt
Mhm.
this, because I'm sure now, almost hard to believe, Lynn, like 2 years now, the feedback from the public who's probably absorbed this has been nothing short of phenomenal, saying, hey, I'm able to get this kind of information. And, my doctors, my nurses are better informed because of it.
Yeah, it's been really, really positive. And it'll get even more so. So there's a new project being pushed by the province that we hope to have implemented in Erie St. Clair over the next year, which is called Connect My Health. And it'll essentially provide all the information that's being produced at the hospital to the patients via a secure web application that the province will be providing. So it just provides that next layer of connection, which we wouldn't have been able to do without implementing Cerner, because everything would have still been paper based. It would have been hard to get that information into the system without it being scanned, and you're having to deal with people's handwriting and everything else. Now, with it all being consistent and the data being able to be sent to this Connect My Health, our patients will now have ready access to their data probably within the next year or so.
I wanted to ask you too, Lynn, with the new hospital set to go on County Road 42, um, are we in a better position locally to have, because you've had such success with Evolve through the years, to really put a stamp on, this new hospital that's coming and say this is going to be sort of cutting edge in terms of technology?
Absolutely, and we're already having some conversations with many of the technology vendors, because as you can imagine, when a new hospital goes up, everybody comes out of the woodwork saying, "Oh, we've got the latest and greatest technology
Sure,
here
sure.
to show you." And so we're actually having some really interesting and new conversations with these vendors saying, great, you have technology, but partner with us instead of trying to sell to us. Partner with us so that we can deliver the best experience, not only for our patients, but also for our staff. How do we get to something where it's truly what I would call digitally enabled so that we're easing the burden both for our patients, but also for our providers at the end of the day? And what's been great about these initial conversations with many of these providers is the fact that they are these vendors is that they actually want to have those conversations with us. They recognize that the tax dollars that pay for a new hospital, that pay for the technology, are very limited. And so they're working very closely with us right now to figure out what are the right strategies to make sure that organizations can afford this type of innovation going forward.
And then also put the power into the patient's hands too, right? We always talk about these and how important
Yep.
they are, but having the patients be a part of their healthcare journey and keeping them connected on their smartphones and digital devices.
Absolutely. So, looking at, what type of apps can we have? One of the questions that we've been working with Cerner on is, how do we make things like their web app, uh, which is around patient care management, more available at a better price point for for the system. Our patients would never have to pay for it, but somebody does. So, how do we make that more available so that a patient can easily go through their phone, make appointments, communicate with their right provider, send a note. If you have diabetes, be able to upload your diabetes information so that your physician can see how well you're tracking. So we're starting to explore all of that. Cerner has some great apps, and it's just a matter of staging it correctly so that we can put it in as we follow what the province is trying to do from a strategy perspective as well.
Tech Talk continues. From business acceleration, building and engaging the tech community, and championing tech and innovation. Follow WeTech Alliance on social media or visit them on the web.